Hi, I am Dr. Mike Van Tielen, and today we talk about the depth of injection with Lipodissolve and Mesotherapy. Lipodissolve is the injection of substances to dissolve localized fat and or treat cellulite. We need to know that this is symptomatic treatment. Therefore, we need to inject where the fat cells are. And where are the fat cells? The fat cells are located in the hypodermis. The hypodermis is approximately 6 to 12 millimeters deep in the skin. So in order to effectively treat localized fat and cellulite, we need to inject between 6 and 12 millimeters deep. Now, we recommend to inject with 30 gauge half-inch needle. A half-inch is approximately 12 millimeters. So in order to be between 6 and 12 millimeters deep, we need to angle that needle at approximately 60 degrees in order to be right in the middle of the hypodermis. If you would inject perpendicularly, you would be at the lower end of the hypodermis and your results will be limited because most of your product will be absorbed by the muscle underneath the hypodermis. So again, Lipodissolve injections for the treatment of localized fat and cellulite, make sure you angle your needle so you inject your substances between 6 and 12 millimeters deep. Next, mesotherapy. Mesotherapy, we need to inject in the high end of the dermis. Why? Because we want to stimulate collagen to treat wrinkles. We want to rejuvenate the skin with antioxidants, minerals and vitamins, or we want to tighten the skin with vitamin C, DMAE or homeopathic formulas. So therefore we need to inject symptomatically in the skin, which is the high dermis. So we need to inject about 2 to 4 millimeters deep. With a 12 millimeter or half-inch needle, that means that you need to angle your needle at a 30-degree angle to be right at the 4 millimeter mark. So in order to get great results, make sure you inject in the right layer of the skin.